Hi, this is Dr. Williams with Peacock Pediatrics. I wanted to talk to you a little bit about constipation today. So constipation is a really common problem that we see in our office, and there are a lot of things we can do to help. Constipation is infrequent stooling, hard stooling, stools that are difficult or painful to pass, and can often cause lots of belly pain and bleeding with stooling, or anal fissures. Fears of using the toilet. Little kids will start to withhold stool because they're afraid it's going to hurt. Some kids can even get so constipated that they start to have leaking of stool around big hard stools. The liquid stool from above leaks out and causes big messes. So it's a real big problem for some kids, and we can really help you get on top of it. Oftentimes we can feel hard, lumpy stool in your child's belly when we do an abdominal exam, and we don't even need fancy tests or x-rays to diagnose constipation most of the time. I tell parents all the time, my goal is perfect poop. It kind of slips out of their bottom with minimal straining. It doesn't hurt. And it swirls up in the toilet, kind of like the poop emoji. So in order to get that, there are things we can do to prevent constipation, like drinking plenty of water. Everybody kind of wonders how much water is enough, right? So a 1-year-old should get about a liter of water a day. That's about 32 ounces. If your child's early elementary, like 5 or 6, they should be getting about 1.5 liters of water a day, or 48 to 50 ounces. Older teenagers need 2 to 2.5 liters of water a day, even up to 80 ounces a day. More water in your diet equals softer stools because the water stays in the gut and keeps the stool soft. Soft stool moves faster and easier. Another way to help prevent constipation is by choosing real foods. So shopping the perimeter of the grocery store, eating the rainbow, choosing fresh fruits and vegetables, limiting processed foods, and dairy especially can be really constipating. So we recommend in kids who tend to be constipated that we decrease the amount of dairy that they're taking in. The other thing that can be really helpful for preventing constipation is regular exercise. So at least 60 minutes of physical activity a day really can help kids prevent constipation. And then training your children not to hold it. So if they have to go, they got to go now. The longer they hold their stool in, the more water is absorbed in the colon and the harder the stool becomes. Mild constipation typically can be reversed just by revisiting some of these preventative measures. If you've done those things, you can also add in a little bit of juice. I like for parents to think of juice as medicine. So kids don't need any juice. There's no nutritional value, but it does help with mild constipation. So adding 4 to 6 ounces of juice into your child's diet a day can help some with constipation. If the children are a little bit more moderately constipated, or you've tried those things and it's not worked, pediatricians really love a medicine called polyethylene glycol. You can buy it under the brand name of Miralax, but really the generic medications are just as effective. The medication is a white powder that mixes into juice or water or some sugar-free sports drinks. Typically, we would start with 1/2 cup to a full cup a day and about 6 to 8 ounces of liquid. And the nice thing about Miralax is that you can't taste it, you can't see it. If your kids are really picky, you can mix it without them watching you and they won't even know it's there. The medication is not absorbed by the gut. It stays in the intestinal tract, so it doesn't cause cramping or bloating. It doesn't cause dependence, so you can use as much or as little of it for a short or as long a period of time as you need. And that makes it a really good medicine. What that medicine does is it pulls extra water into the GI tract, and like we said, that equals softer poop. The kids who have more severe constipation, so those who are really struggling and leaking stools, often will need a bowel clean out with multiple doses of Miralax over multiple days in a row to help get them past that point, combined with timed toileting, so sitting on the toilet to attempt to go to the bathroom after every meal or snack. That's a little bit more of an involved conversation to plan that out. And so I would recommend, if you have concerns about stool leaking or severe constipation, severe belly pain, or issues that are not getting better with the above measures, then I would say, hey, give us a call. We'll be glad to get your child in, do an abdominal exam, make sure we've got a good history of the symptoms, and help schedule out a plan that will work to help improve your child's symptoms. Give us a call, like I say, at Peacock Pediatrics, 816-396-6026, and we'd be glad to take care of you. Thanks so much.